Hello ladies, sorry for the delay in the latest videos. I do apologize. Things have been kind of crazy around here. I picked up another client and we decided to paint the exterior of our home, which I would highly recommend never doing. You should hire that out because as nurse practitioners, you will have enough money in order to do so. Yes, so anyway, my knee is still trying to heal from all the up and down off the ladder for that. So just, yeah, don't do that. I wanted to just post a video about some things that you can do in order to prepare for the heart and lung exam, as well as a few just housekeeping items. First of all, there are two different things that you need to turn in to me after your heart and lung exam. And I know that was kind of confusing and I apologize. I know videos clear things up a lot better than email. And again, I do apologize. It's just been so crazy around here and I've been covered in paint. And so I just didn't want to post a video. But I will say that most of you, I got it back. The self-evaluation that you have to do is a building document. So after you filled it out for the mental health exam, then you'll fill it out for the heart and lung, and then you'll fill it out for your head to toe. So you just keep adding to that as the semester goes. So that's found under modules on your Canvas page there. So just go ahead and try to find that, fill that out, send it to me. When you sign it, I want you to sign it using a font, like a calligraphy font or script font or whatever that looks like a signature, and then just send that to me on a Word document because I actually don't have a program to manipulate PDFs. So then I can sign that and then I'll just send all those off together. I probably won't put a lot of comments on those self-evals just because I'm providing you the comments when I do your rubrics for your overall exam that you have to do. Okay, so again, for the rubric, I fill it out, I sign it, and then I email it to you. So then you just would sign it, keep it in that Word document format, sign it with some calligraphy font, and then send it back to me. Okay, and then don't forget to sign up for a Calendly appointment. I think most of you have, only a few of you haven't. If those times don't work, please let me know. My schedule is changing by the day, especially as COVID comes and goes. It has been absolutely crazy around here in my life and probably in your life as well, and we just really can't predict how our schedules are going to be tomorrow, let alone in 2 weeks from now. So if those times don't work for you, that's okay. We will figure it out. I am not going to worry too much about that deadline. I know that both instructors have kind of given me some leeway on that. So let's just try to get it done that week. But if something crazy happens in your life, please let me know. And if one of those times doesn't work for you, please let me know and we'll try to figure something out. Excellent work on your first exam. Most of you did an amazing job. I know an 84 to you doesn't sound like an amazing job, but guess what? It is passing, and that's amazing because that's what you know, or that's what you need to know in order to pass. And I will tell you that 84% is really high as far as what you have to have mastered in order to pass the exam. So if you think about it, you've retained 84% of the information that you have read, watched, and reviewed. That's really good. So you'll just want to keep that in mind as you keep progressing through the course, that 84 is that goal. That means that you have a really good understanding of the material and you're just going to keep building on that as the semester progresses. If you didn't make that 84 benchmark, I would encourage you to spend more time on your text, more time with videos, more time, go to the Zoom meetings that the instructors are holding, and just try to get a better understanding of the information. And you might have to make some sacrifices in your life, whether you cut out extracurricular activities, you cut down on your shifts at work. If you didn't pass that first exam, you might need to look at some of those things in your life and see what you need to get rid of in order to be successful in this course and your other courses as well. I basically just told my friends I would see them in a few years. And as drastic as that sounds, that's literally what happened. So when I did pass my exam at the end, I texted everyone and I was like, I can be your friend again. So they understand that sometimes in our lives get a little hectic and we do have to make those sacrifices. I didn't watch TV. I mean, you know, the things that you get to, that you can cut out, just think about those so you can try to increase that score, especially if you're not comfortable with that 84 number. That was what I think was the average. If that's not comfortable for you and you want it to be higher, then you'll just have to make some more sacrifices to find more time to study. Okay, so for the heart and lung exam, I printed out this rubric and I made a bunch of notes on here when I was watching the videos. I went back through those videos just to see kind of what the information was that they gave you on the Bates videos, the thoracic and lung, and then the cardiovascular sections, to see if what they gave you matched up to what I would be assessing you and your skills that you're doing. And they do match up pretty well. For the cardiovascular system, there's 4 of those videos that you should really pay close attention to. Assessing the carotid pulse, inspection and palpation of the heart, auscultation of the heart sounds, and attributes and grading of murmurs. So I think the attributes and gradings of murmurs went a little more in depth in that we need to know. I really just need you to describe a grade 1 and grade 2 murmur. Kind of get comfortable with that intensity scale and what numbers you would need to use. So honestly, when I was looking over this, it doesn't seem much different than the cardiovascular and respiratory exams that I do for undergrads. There's not that much difference. I mean, the inspection, you know, your jugular, and then the 6 areas, the palpation, the carotids, and those other pulse points. Auscultation. Now, as RNs, we don't auscultate the carotid, so you'll want to practice with that. Make sure you watch the video. Make sure that they know, you know how to do that and the assessment technique that you need in order to do that. And then, I am so sorry, my dog is barking outside, and I don't feel like getting up to dry him off and let him in right now. And he's an 80-pound furry dog. He'll be just fine out there. And it's not that cold. So we know as RNs that we have to say, oh, that person has a murmur. Well, now we're upping the ante, and you have to be able to say, okay, that's a grade 1, that's a grade 2, that's a grade 3, that's a grade 4. They also want you try to denote, is it an S1 split or an S2 split? Is it mitral stenosis? Is it aortic stenosis? What's causing that murmur? And so you'll need to know textbook-wise absolutely 100% murmurs and what causes them and what murmur is caused by what. For the purpose of this exam, it says that you just need to be able to describe those murmurs, grade 1 and grade 2, not necessarily tell me the difference between the mitral stenosis and aortic stenosis. But you will definitely want to know those things, if not for this exam, for boards for sure, because that stuff is all on there. Okay, so then for the thorax and lung section, basically you just watch the videos that's examining the anterior and posterior thoracic and lung, normal and adventitious breath sounds, and then auscultation of the posterior and anterior chest. And I think they have the same title, like auscultation of posterior and auscultation of posterior, but they are different. They're not the same. So make sure you watch both of those. Now, I will say, as far as that goes, again, it's pretty much the same as what we do as RNs, except we're going to actually put our hands on people. And you'll come to realize that as a nurse practitioner, you're putting your hands on people a lot. I mean, you really have to touch them and feel them and see if what they're, you know, if they're saying, oh, I have this bump right here on my leg, can you feel it? I mean, so you need to be really comfortable. And we don't wear gloves. I mean, we do wear gloves when we are performing procedures and stuff, but as an NP, we really have to rely on our tactile sense to be able to assess our patients. So just get comfortable with touching people, feeling their chest, feeling it rise and fall. This says you need to inspect the chest wall, assess for breathing, and palpate for tactile fremitus. And it shows you very easily how to do that in the video. So just pay attention on how to do tactile fremitus. You don't have to, according to this rubric, you don't have to measure the diaphragmatic change for inspiration and expiration. Yeah, so don't worry about that. Just worry about doing tactile fremitus and how that works. Then you'll want to make sure that you practice percussion. Percussion is something that takes practice and time, and the only way you get better at it is by doing it more and more and more. One suggestion I have for you, and this is going to sound absolutely absurd, but if you learn to percuss for 2x4s in your wall, that could be very helpful to you. So you basically, they say to use 2 strikes over your third finger. So you're using your middle finger and you're thump, 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 thump. So if I were you, I would go along my wall and try to hear the difference in pitch and resonance. Like you use your knuckle to find a 2x4 in the wall. Just practice that and see if you can't start to hear the differences in pitch, because that's what it's going to sound like when you're doing it on a person who has fluid in their lungs. You start to percuss and you start at the top and you go down and you're like, oh, that just changed pitch. I don't even know what pitch is. I am not a musical person, but I'm like, oh yeah, that changed. Whatever that is, that's not right. And so you start to do that. I mean, one of the preceptors that I was with, she was really good at it, and she's been doing it for a really long time. And she would percuss for liver, and you're gonna have to wait. She would percuss for liver and all kinds of other things. I am not that versed yet in percussion, but I was able to use percussion to assess for pneumonia. I mean, I assessed a patient and I said, something's not right with this patient. I think they have pneumonia. And she goes, well, you should percuss them. So I went back in and I percussed them. I'm like, oh yeah, there's something in there. So it is a handy tool to have in your toolbox, and I would recommend practicing it. It is not intimidating. It is something